Welcome back. And in today's demo, what we'll try to do is we'll try to do a simulation of joint review by multi super specialty doctors. And we will see how that pans out, right? So in this prompt, if you can see, what I'm trying to do is simulate a review by a joint review by rheumatologist, neurologist, endocrinologist. The patient has chronic brain fog, joint pain, fatigue, and everything, right? So labs show so and so, and what are the top different diagnosis and next steps. So let's see what's the result that comes up by giving this thing. So now what we are doing is we are not using ChatGPT as one doctor, but we are using ChatGPT as a super specialty of multiple doctors. And we'll try one or two more cases and see how this comes up, right? Because in this way, you're able to multiply the knowledge of ChatGPT and try to take maximum responses from ChatGPT. Let's see what it comes up with. So it says, okay, there's a joint review now from rheumatologist, neurologist, endocrinologist, borderline TSH. Okay. So this is for hypothyroidism, but wait. Let's see. So it's also mimicking that it's doctor's name is Dr. Asha. She's a rheumatologist. Maya's chronic joint stiffness, fatigue, and mildly raises ESR suggest a low grade inflammatory process. But in the absence of specific antibodies, which is negative ANA, all right, makes classic autoimmune arthritis less likely right now. So this is the review from rheumatologist, but it has not given the review from this. So I'll say, give me the review from neurologist as well. And let's see. Now neurologist. Again, it has mimicked it saying that I'm acting like Raj Iyer is the doctor neurologist. Fatigue and brain fog along with B12, possibly subclinical neuropathy or central sensation. Even borderline thyroid issues can contribute to mental slowing or cognitive clouding. Oh my God, I never knew that thyroid can have so much of impact on mental thing as well. So it has given some information. All right, next steps is get B12 injections, neuro exams, evaluate for depression and anxiety. That means you are going to tell a psychiatric doctor. Now, another doctor is Meena Rajput, endocrinologist. Now, she has given her inputs. Okay, with brain fog, joint pain, I strongly suspect Hashimoto's thyroiditis. And it says top endocrine differentials, which are subclinical hypothyroidism. There is something more, and everything. And a unified panel summary, right? It says autoimmune disease are there, which are the reasons. There's B12 deficiency, this is the reason or central sensation. This is the reason. And now it's suggesting next steps for Maya. You have to get these tests done. Why need these tests? Because to confirm autoimmune or to correct deficiency to monitor inflammation. Now it's also asking, do you need a PDF sheet or doctor summary? Let me say yes. It has generated a lovely case summary. It has given the symptoms. It has given the key lab findings. It has also given multi-specialty summary, especially what are the conditions, what are the reasons why it is calling it out. It has suggested next steps, okay, and why with all the background. Now, if you want more information, it can provide that also. Suppose you want a treatment plan, you can ask for that. But let's get to the next step here because it said that there could be a psychiatric evaluation. Let's see a toxicology and neurologist. This is one of the last things we'll try in this particular case. And let's see what the response comes up. Good. Now the response has come. Is a simulated multidisciplinary review. Now the disciplinary review is with toxologist, neurologist, and a psychiatrist, okay, for the same patient. Muscle weakness, high pollution area like Delhi, has high elevated liver enzymes, has low B12. So now let's see. So RK Joshi is the doctor, environmental toxicologist. Living in high polluted area like Delhi means chronic exposure to airborne toxins, heavy metals, and indoor pollutants. This can burden the liver, increase systematic inflammation, and even contribute to fatigue and neurological symptoms over time. Such a beautiful thing it has given. It has given key environmental factors to investigate heavy metals, whether lead, mercury, arsenic from water, air, cosmetics, cookware, volatile organic compounds from incense, perfumes, cleaning agents. It could be dampness or mold. And it says recommended test. These are the tests that the doctor has given. All right. Now it's simulating itself as a doctor and also advise use RO plus UV purified water, avoid plastic containers, scented candles, consider an air purifier at home. Neurologist. What does neurologist say? That muscle weakness, brain fog with B12. all right, with a mild liver involvement, raise concern for a toxic or metabolic neuropathy. And again, neurologist has given their inputs and some advice as well. Last one is psychiatrist, Dr. Ankita Kaul. She says long-term exposure to pollution fatigue, all right, can contribute to low mood, irritability, cognitive dulling, and so on. From a psychiatric consideration, environmental depression, lack of motivation, fatigue, brain fog, environmental and physical symptoms can cause chronic fatigue syndrome. And there's more about sleep quality, and there is some advice that has come and a unified checklist. There's basically for instigative checklist they have given. Now they need a urine heavy metal test, liver function test, and these are all the tests. Nutrition, these are the tests. Neurology, these are the tests. Without these tests, they cannot evaluate. So next step, start B12 and vitamin D supplementation, run heavy metal test, improve air quality at home, recheck liver. And if you want to download the summary, it is happy to do that. You want more questions, you feel free to do that. All right. Thank you for joining. We'll connect again.
Subscribe to Career Story 60 and unlock your ChatGPT superpowers.